When India adopted this population policy in 2000, prior to that itself, from 1990s itself, it was a very clear realization that there is a very clear correlationship between a number of social determinants
Yes.
and the population dynamics.
So also, sex ratio is not a very good indicator of our attitude towards girl childs.
Okay.
It is the child sex ratio that actually tells you
Absolutely,
the
definitely.
shift in the attitude.
For sure.
So therefore, I urge everybody to look at the child sex ratio, less about sex ratio.
Right there through the population explosion stage also and continuation in the present time also, there is a huge divide, let's call it north-south divide.
Okay.
So north-south divide in which the population indicators, demographic indicators have been improving steadily in the southern states.
Right.
Okay, whereas in North Indian states, if we see, these indicators are not showing very encouraging trends.
Right. Hello and welcome to Bariar's IAS Academy. As a part of this podcast series, we try to make sense of the jungle of data that is available across the public media. And as a part of today's discussion, I am here to discuss the civil registration system data that was released very recently. And I have with me a very special guest, Mr. Indrajit Bariar,
Thank
the
you.
founder of Bariar's IAS Academy. Sir, I welcome you to the podcast.
Thank you, sir.
So we have the Civil Registration System 2023 report that has come out recently.
Absolutely.
Sir, I want to understand, the newspaper is replete with data on population. Every year something or the other
Definitely.
keeps coming on population. And therefore, can you throw some light on what are the most relevant source that I need to look at for the population data?
So as far as population data in India is concerned, okay, we have multiple surveys and reports that comes out, and first thing is to understand the differences between them.
Yes.
At the three level, basically, if we see, the first one is a decadal exercise, that is the census that
Census
takes
data.
place.
Right.
Okay. On the other hand, there is something called a sample registration system, SRS.
Yes.
And at the same time, we are talking about the civil registration system.
So civil registration system and sample registration system are different?
Yes, absolutely.
How
Now,
are they
as the name suggests, okay, sample registration system takes out and extrapolates the data based on a sample size.
Correct.
Whereas the civil registration system is based on the actual registration of births and deaths in the country.
So whenever a birth is occurring or a death is occurring, the registration that happens at the local level in the institution wherever
Absolutely.
the death is registered. So that registration is part of the civil registration system.
Civil registration
and
system.
not the sample registration.
Absolutely not. And this registration was mandated by Registration of Birth and Death Act 1969.
Okay, it is backed by a law. Also.
Absolutely. Very recently in 2023, it has been amended also,
Yes.
where now the idea of digital
Right.
capturing of the data, digital registration has also been brought in.
Okay. It has already been covering all the states
It
in
is
India?
in the process of rolling out.
Okay.
With the Digital India and those initiatives. Okay, definitely it is in progress. But as far as if we see the registration in India and the registration proportion is concerned, okay, increasingly we have an increasing trend of this registration of birth and death taking place in India, which has been observed.
Sir, what necessitates this live birth recordings or death recordings as against the decadal capture of data?
The most important thing we have to understand is the correlationship between population and development.
Right.
And for the first time, this idea was put forth by Malthus.
Right.
Okay.
Right.
So Robert Malthus way back proposed this
18th
idea.
century.
Yes, absolutely. That there is a correlation definitely between the population growth and the development.
Correct.
Although eventually it took a lot of time for rest of the world to realize this and implement it at the government policy level.
Correct.
But yet in the modern times, including India, the countries have realized that their policy formulation should be guided by these demographic indicators. Now this decadal exercise, it's a long term. okay, where you would be able to tweak the policy only after the 10 years.
Correct.
So the CRS, okay, although does not comprehensively cover all the demographic indicators,
Correct.
but yet at least in terms of the birth rates, the death rates, and the projections from there, gives policy insights to the policy formulators in the country.
Okay, so and in addition, is there any other source of data that is relevant?
So on the global scale, when we talk about United Nations, so United Nations every year will publish its population data sheet.
Right.
Okay, but that is more or less on a macro scale, we will say, because they do not have definitely access to the data at the micro level as our government agencies do.
Right.
But yet, on the indicator level, indicator basis, definitely the population data sheet serves well to us.
So, as I look at it, the census data and civil registration data gives us the structure of the population.
Absolutely.
But what about the behavior of the population? That is captured by the National Family Health
National
Survey?
Family Health Survey. So, National Family Health Survey is another indicator, although I will not consider it to be a true demographic indicator.
Because again,
but
it's
yes,
based on a sample.
absolutely. It's again based on the sample size.
Right.
But yet, the behavioral aspect of population dynamics, that can be understood very clearly by NFHS.
And that is why the growing relevance of NFHS.
Definitely.
And what are the findings of this survey or this report that has come out now, sir? The civil registration system. How important are the observations of this report also? Is something I want to understand.
So this whole report that has come out, okay, it basically have dealt with three major data,
Right.
okay, which is the birth rate, okay, birth rate or total number of births, let's say, including the live births, stillbirths that also have been tracked,
Right.
the death rates, as well as the sex ratio of the population.
Sex ratio also. Okay.
And so these become very important indicator from the perspective of, most importantly, I would say, the demographic transition
Right.
that India as a country is going through.
Right.
So it is very important a stage for India, in fact, and as a sociology faculty, I would in fact like to understand it from you that the finding has been definitely that our fertility rates are going down, mortality rates are going down. So how much of this observation is significant with respect to our demographic transition?
Sir, I go back in history. 18th century was the first time the world reached 1 billion population.
Absolutely.
And from then on, when we see the rate at which it was increasing by every billion, the number of years it took to increase by 1 billion always reduced. Now I think it is about 16 years or 14 years. It is always reduced. And therefore, for the first time, okay, a behavior of the population structure itself was modeled, and this is what we call as the demographic transition model. It says the population structure or the population size follows a natural process, and that is only talking about the size of the population. So when we look at the demographic transition model, the model actually talks about 4 phases of any population. In the first phase, the death rates will be extremely high, but it will be fluctuating. And the birth rates are also very, very high at this point of time. But birth rates also, at some point of time, birth rates also are not as high as death rates. Death rates are extremely high. And this was probably and this is the first phase in which the population is somehow controlled.
Absolutely.
Controlled, but it's a natural control. That is maybe because of the lack of advancements in the medicine and so on and so forth, infectious diseases, or this is war period, pre-nation state period where there were a lot of wars being fought, and therefore death rates were very, very high. The second phase is in which the death rates rapidly decline, but the birth rates continue to increase. Given the advancement in science and medicine, this is what we call as the population explosion phase, where the death rates are rapidly falling.
Yes.
And the death rates are rapidly falling, and the birth rates are
still remain high.
Remain high, or it's not declining at all. And in fact, to give you a very interesting example, in Sri Lanka in 1950s, I've heard that the death rates decreased by rapidly, I mean this. So Sri Lanka, the death rates declined by more than 70% in
Okay.
a span of 3 to 4 years
Hmm.
after the use of DDT. So
Uh-huh.
DDT led to control of malaria, and therefore, it is said the antibiotics or
Absolutely.
DDT or vaccines
Hmm.
have led to this decline of death rates. And the third phase, and this is the phase that we as a country, India, faced a big challenge of population explosion. And we have had our policies actually trying to exactly target this population explosion phase. And the third phase is in which the birth rates will start to decline and the death rates have stabilized. So, therefore, this phase is somewhat the population stabilization. Although the population is still growing in numbers in terms of actual size, but the rate at which it is growing is declining because of the declining birth rates. And this owes its success mostly to this connection between development and population you just
Absolutely.
mentioned. And the fourth phase in which the population starts to decelerate, and all populations will follow the same model according to the demographic
Correct.
transition. So I want to know from you that this CRS, the civil registration system, what is it? What are those numbers really hinting at some demographic transition from one phase to another?
Absolutely, definitely. See, as far as India's demographic transition is concerned, we transited from first phase to second phase in 1921.
Right.
Okay,
right,
which is called as demographic divide for India
Yes,
also.
yes.
And in 2001, in fact, India is one of the only country in our region, okay, who has reached into the third stage of demographic transition.
Right.
So
in
from
South Asia.
absolutely in South Asia, and that is primarily and most importantly due to the socio-economic developmental indicators that we are talking about.
Right.
The overall, when India adopted this population policy in 2000, prior to that itself, from 1990s itself, it was a very clear realization that there is a very clear correlationship between a number of social determinants
Yes.
and the population dynamics.
So education and fertility
Absolutely.
is directly correlated.
Straightforward. Education for women. Okay, increasing participation of women in workforce.
Yes. Yes.
Okay,
Income
as
levels. And
income levels as well as maternal health
yes. Yes.
also played a great role.
Yes.
And all of this in fact resulted in overall reduction in MMRs, IMRs, which eventually indirectly brought down our fertility.
The fertility rates also.
So
And
from 2001 onwards, we have been observing a very clear trend of
Right.
India in third stage of demographic transition.
right.
And we have considerably brought down our fertility rates.
Yeah. So what is the beginning point of fourth stage, sir? Fourth stage is what we call as post-transition.
Absolutely. So fourth stage is where India is going to or expected to reach somewhere around 1960.
1960.
2060, sorry.
Yeah, 20.
2000,
yeah,
2060.
yeah.
So 2060, 61 is the time when India's population is going to peak.
Right.
Although our fertility rates are considerably down.
Right.
Okay, in fact, if you look at the TFR values,
It has
okay,
reached the
it
replacement
has
levels, reduced
in
more
a
than that.
lot of states it has gone down below replacement levels also.
Correct.
Okay, and India's overall TFR itself has become 2.0.
Yes. Yes. Much less than
2.1, that
is
would be the replacement rates. But still the question remains, ki then why is our population increasing? So
Right.
that's the question which can be answered with the concept of demographic momentum.
Yes. Yes.
So
Population momentum.
Absolutely. So demographic momentum where we already have a cohort
Yes.
from a period which was very high fertility rate.
Yes.
And
30% of the population is between 5 to 24.
Absolutely.
Yeah.
And overall, if you see this particular cohort, along with the fact that India's longevity has increased.
Yes.
Okay, our average longevity has reached almost 67 years now.
Right.
So all of this translates into this whole cohort moving into the old age group.
So in simple words, can I see population momentum as shifting of in the pyramid, age pyramid, if we see, the shifting of the
Lower base
from
part into the middle part.
Lower age to a little higher age.
Absolutely, the reproductive age group.
Okay, I very nicely explained.
So that is where we are going to enter into fourth stage, and that is when we are expecting population stabilization to be taking place.
Okay. So civil registration data is still capturing the data of the newborns. Newborns in terms
yes,
of...
definitely.
So is there anything that this report highlights that is very interesting, sir?
Basically, in this particular report, there is nothing as such what was not expected.
Right.
It is in fact a continuation of the trends from the last 4 or 5, in fact, last from 2018-19 onwards. Okay,
Right.
apart from that COVID impact which was there,
Correct.
if we eliminate that particular impact, there is a continued trend of the same patterns
The
that we can
declining
see
death
over
rate
here.
also, birth rate also
Absolutely,
declining.
absolutely.
Correct.
But in this case, definitely what we see, one of interesting thing, or rather, I should not call it interesting, but polarization in terms of the trend, where
Okay.
spatial variations in terms of demographic transition, okay, is huge.
Right, right. Do you see any reason behind the spatial variation? I mean, some areas having
Definitely, definitely. So
still in the population explosion stage then.
right there through the population explosion stage also, and continuation in the present time also, there is a huge divide. Let's call it north-south divide.
Okay.
So north-south divide in which the population indicators, demographic indicators have been improving steadily
Okay.
in the southern states.
Right, right.
Okay, whereas in North Indian states, if we see, these indicators are not showing very encouraging trends.
Right, right.
Similarly, in Northeast also, we find encouraging trends. If I see the space of demographic transition that is taking place, okay, the states like Tamil Nadu, Kerala, Karnataka, or from the Northeast, Arunachal Pradesh
Arunachal,
especially,
yes.
okay, they are performing very well.
Mizoram has always
Mizoram has performed always very well.
Yes, yes.
So there can be few reasons that we can identify. One very important one is a lot of these societies are following a matriarchy system.
Right, right,
Okay, which very clearly tells us what is the significance of role of women
right.
in terms of demographic indicators as well as development. Plus, along with that, definitely income levels. First thing,
Development indicators.
educational levels, all the developmental indicators definitely point towards a very clear divide.
So if I look at I mean, to give a trick to the user, to give a trick to our audience, if they take the development indicators map of India and
Superimpose
superimpose it on the demographic transition map, they will
definitely.
exactly fit, and wherever the low development indicators are there, it will say how the pace of development, the demographic transition is slower.
For sure, it would be there.
So the policy should definitely. So then we keep hearing of two-child policy, one-child policy, and so on and so forth in different states, also state level.
Absolutely.
policies, although it sounds political. So at the policy level, it should essentially be development, and the demographic
It
transition
should be development.
will take care
The
of
demographic
itself.
transition model itself takes care of things.
Of itself.
Because
yeah.
one very interesting point in demographic transition model which is there.
Right.
Okay, that is about the third stage of demographic transition. When Nottenstein says कि why the fertility rates start decreasing. Okay, we say कि ठीक है education and XYZ, but one more very important and very interesting point he brings out, that is the cost of raising children.
Cost of raising children. Yeah.
And he says कि now at this particular stage, because he clearly associated socioeconomic development with transition.
Absolutely.
So he says reaching third stage, definitely economically you have developed.
Yes.
But this is the first stage of development.
Yes.
So your inflation levels would be high.
Yes. Yes.
Cost of living would be high. So even if you want to,
This,
you
there
cannot
will be
raise
small-
4 to 5 children.
Yeah, there will be small family norms because the cost of living.
Definitely,
is-
definitely. So economic conditions themselves are taking care
Yes.
of the demographic factors.
And I think our policies also are in line with this understanding, because if I remember correctly, in the first phase, our policy was a moral approach, where
Absolutely.
we were asking the couples not to give birth.
Yes.
Of course, it did not work. Needless to say, it did never worked. Only then it was realized that it was the development that is going. It's only the pace of demographic transition that you can change, or you can intervene at, not the population as a
Definitely.
structure itself or the numbers itself.
Definitely. But one thing, Arun sir, what is worrying in this particular report, okay, that I always keep pondering over, is the sex ratio in India.
Right.
Even with a lot of initiatives that have been taken, I'll also give you a few examples, interesting examples on this. Okay, with the legislative measures like PCP NDT Act also in place, everything in place.
Correct.
Yet, on an average, if we see, the sex ratio is still Okay, 2011 census talked about 927.
Right.
And now, after almost more than a decade has been passed, we are waiting for next decadal census.
Yeah.
And the CRS data is telling us 928 is the sex ratio.
It
So
is plateaued there.
absolutely. So first thing, okay, why we have plateaued there? And secondly, where are we lacking? What is the lack in our approach?
Sir, there are two things in this. One is there is no denying the fact that the sex ratio is below par. But there are also a couple of things that skips the eye. Number one, that by in nature, the sex ratio is skewed in favor of the males.
Correct.
So it is, I think the natural sex ratio is 950 females per every
Per 1,000
males. So if we are hovering anywhere around 950, we are doing good. Actually, that is the first caveat I have to admit.
Okay.
That's number one.
That's very much Indian.
Very
I think
much Indian. Number two is also sex ratio is not a very good indicator of our attitude towards girl childs.
Okay.
It is the child sex ratio that actually tells you
Absolutely,
the
definitely.
shift in the attitude.
For sure.
So therefore, I urge everybody to look at the child sex ratio, less about sex ratio. Sex ratio is because of the historical factors. Because but the bad thing about sex ratio, or a bad sex ratio, or a lower sex ratio, is despite women having a higher life expectancy at birth, why is the number like this in adults? So that is a problem. That is the problem.
But I understand your point.
Yeah.
But my main issue is, let us take all the parameters into consideration.
Correct.
Even when we are saying child sex ratio is 940, let's say,
Right.
according to census 2011.
Correct.
Good sex ratio, let's call it child sex ratio.
Yeah.
The whole of the idea was this ratio dropping down in the form of overall sex ratio,
Right.
okay, was due to higher female mortality.
Higher. Yes.
That was the reason.
Yes.
Okay,
Yes.
there are a number of factors behind that: nutritional neglect, health
Yes.
neglect, and so on.
Yes.
But over the period of time, we are claiming that our MMR has also improved.
Yes.
Overall, female
IMR.
health is also improving, which is evident from the fact that, okay, in the last few years only, for the first time in India, life expectancy of females have surpassed the males.
Yes.
So if all of these are in numbers where we see that, okay, life expectancy of females are also increasing and all, why is it not translating into increasing number in the in the overall sex ratio?
Well, although we have taken some legislative measures, as you said, you spoke about the PCP and DT Act.
Yes.
And Beti Bachao, Beti Padhao
Beti
is
Bachao.
actually to improve the implementation of PCP
Absolutely.
and DT. But I think, in fact, Economic Survey 2022, I think, or 2021, very clearly admitted the presence of what is called as a son meta preference. So, and it identified about 200 missing girl children. Okay, as a result of it is either due to infanticide, due to feticide, or even after in the adolescent age due to lack of nutrition and education and so on and so forth, or bad health. There are mortalities even at that stage. That is why the Economic Survey identified 200 million missing children. That is, I think, and that is a big number, 200 million.
Definitely.
And therefore, probably that is also adding to the skewed sex ratio, the overall sex ratio. But I would still see the child sex ratio to see the immediate attitude change, like
Definitely.
the women representation in the parliament, reservation in the parliament. Although it will take some time to be implemented. But all of those measures, or Beti Bachao Beti Padhao also, those measures, the impact of those measures have to be seen at the child sex ratio level. Still, I would say that. But yes, I mean, missing millions is always there.
Definitely. And the interesting part that I wanted to share with you is a deviation from 2011 census. From 2011 census, if I compare these most recent 5-6 years CRS data, okay, I find a major improvement in two states especially, that is Haryana and Punjab.
Right.
And that too, Punjab has improved a lot in the
child sex
ranking.
ratio?
In the overall sex
Overall
ratio
sex ratio
as
also.
well.
Okay.
Okay, where these were in the bottom 2 or 3 in 2011 census. Okay, and Punjab now, the sex ratio is almost somewhere hovering around 900 or so. In fact, as I think exceeding 900 also.
Okay.
So there, the awareness campaigns and the programs like Beti Bachao Beti Padhao,
Yes.
okay, has worked wonders.
Yes.
possibly, what we are lacking may be the implementation aspects at the state levels.
Right, right, right.
क्योंकि the same programs which are being run in southern states, okay, like let's say Janni Suraksha Yojana, Janni Shishu Suraksha Yojana, in fact, they have worked very well in southern states, okay, compared to the northern states.
Sir, which brings me to this very important observation in the report about the institutional births.
Absolutely.
Despite maternal and child health being the focus of the policy, especially even the family planning policy, India was one of the first countries to have it. So right from independence, we have had this focus on maternal and child health, and still we don't have 100% institutional birth record in India.
Absolutely.
So what do you think are the reasons behind that?
The main reason from the policy perspective, if I see, the requirements, whatever are there, they are in place. But yet the problem is with respect to the penetration of health institution networks into deep rural areas and so.
Yeah, particularly the public health infrastructure.
Absolutely.
Do you think this privatization of health has actually brought down the institutional births in India because there's a neglect of the public health infrastructure, and therefore they are not able to cater to that section of the population? I'm sure this 26% is from the lower rungs of the society.
Definitely.
Yeah. So do you think that has had an impact?
See, now this is a very controversial question actually you are throwing at me.
Right.
Because there would always be a controversial discussion with respect to whether it should be privatized or not privatized. Okay, what we have seen is, okay, with all the government infrastructure in place, the coverage given the population, level of population in India, it's very much difficult even for the government institution to have 100% coverage. So that possibly should be looked in terms of the possibility with respect to coverage, okay, given the large population. And that's where at one level or another private intervention definitely would be required, is needed in India, because what we have to understand from the perspective of a country like India is government and private, they should complement each other.
Yes.
Okay, it should not be the case of competition, whether we should be there or you should be there.
Yeah, so if the tertiary, the burden of tertiary is taken over by the private.
Definitely.
And the
primary and secondary.
Primary has to be from the government.
Primary has to be from the government side. Okay, and it's not that we have not made improvements. Okay, improvements have been monumental, I'll say. If you look at the rates of MMR reduction or improvement in IMR also.
Yes.
Okay, monumental achievements have been there.
We've way past, I think, the SDGs.
SDGs also. MDG targets we achieved already. So India improved a lot, especially post 2000.
Right.
So post 2000, from the time when we were talking about, there was renewed focus on the correlationship between health and the idea of holistic viewing of the population problem.
Correct.
So from that time onwards, definitely a lot of things have improved only, I'll say. The reach of the institutional health providers is somewhat what is limited, and that is what our policymakers have to be focusing on now.
Right. So what are the key takeaways for you from this a simple report? Of course, it is telling you about...
Of course, definitely. So the key takeaways for our listeners would be very clearly that the most recent CRS report, this do nothing but simply reaffirms the idea that we are on a right path definitely in terms of demographic transition and the projections. Okay, but at the same time, not just looking at this particular year data, but last 5-6 years data. Okay, one thing we have to understand that whole of our projection is properly needed to be taken into consideration for policy formulation. Right. Because at the end of the day, okay, when right now we are enjoying the demographic dividend, this same demographic dividend is going to be converted into the cohort which is going to reach the old age and the aging population. And that aging population issue can become bigger than Japan or Germany, because in absolute terms, they do not have the numbers.
Correct.
Okay, in absolute terms, even our 20 or 30% would be a big number.
Right.
So, do we have the infrastructural setup ready for that? Okay, do we have let's say, for example, old age care system in India in place or not, that would be and the biggest challenge for the policymakers in the present
And the
time.
pressure put by the population momentum also, again, a guide acts as a
Definitely,
guide to the policy.
absolutely,
Right.
absolutely.
So thank you so much, sir. I think this one last thing is, it probably helps us to draw a demographic transition model for all the districts,
Hmm.
so that the development models can be pointed, targeted towards
Absolutely,
villages.
absolutely. The whole idea is one size fits all.
Yes,
Should
will
not
never
be
work.
applied in
Yeah.
a diverse country like India.
Like India. Yeah, yeah. I think with that, I thank you for this enriching
Thank you so much
discussion.
to
I
you
hope
also, sir.